All right. Well, good morning, everybody. Welcome to our June Health Innovation Community Partnership meeting. So excited to have everyone here with us this morning, bright and early here on this June gloom kind of day. So give me a quick second. We'll go ahead and share my screen and go ahead and get started. All right. So thank you again for joining us. For the best meeting experience this morning, we'll ask everyone first to select the language of their choice via the interpretation globe at the bottom of your screen on your Zoom toolbar. This meeting is in English and simultaneously translated into Spanish by our fantastic interpreter, Eliza. We also ask that everyone please mute your microphone unless speaking and enable your camera so that we can see your beautiful faces. Sophia, would you like to repeat that statement, at least about the interpretation icon? Thank you.
Ujú. Bienvenidos para la mejor experiencia de reunión. Por favor, silencia tu micrófono a menos que estás hablando. Habilita habilita tu cámara. Haga el clic en el botón de interpretación para seleccionar el idioma de su elección. Y tenga en cuenta, esta reunión está grabando.
Thank you so much, Sophia. So with that, we'll go ahead and get started. Welcome again to our June Health Innovation Community Partnership meeting. Just a few tips for everyone to make sure we maximize our experience and time together. Please note that this meeting is being recorded, and after the meeting concludes, we will edit the video and post it to our HICPLA.org website. So if you have to leave us early, if you miss a certain segment, or if you'd like to, revisit something that we talked about today, please always visit our website where you'll see all of the meeting materials from this and previous meetings. Once again, please mute yourself unless you're speaking so we can keep background noise to a minimum. And if you want to ask a question during our question and answer period, please raise your hand, or you're always welcome to add a comment or a note into the chat box, and we will look at those at the appropriate time for Q&A. This is going to be a really interactive meeting today. I'm very excited with the panelists and speakers we have. So we look forward to a lot of your questions and having a lot of time for conversation and dialogue. Here's a quick overview of our agenda. We're kicking it off here with our meeting overview, our guiding principles. Then we're going to have an update from our CEO, Jorge Orozco, about what's going on at the LAC-USC Medical Center campus. Then we're going to have another civic arts conversation with one of the wonderful artists who's contributed a piece of artwork to our restorative care village. Joining us today is Lorenzo Hurtado Segovia. Then we're going to have a panel discussion, a panel conversation and Q&A about the restorative care village. So get your questions ready about that fantastic new facility that is up on our campus and on the verge of opening its doors. We'll have another update on the General Hospital and West Campus Development Project. And finally, we're going to spend about 30 to 35 minutes talking about homelessness in our community with a panel conversation with three local representatives from organizations that support the homeless in our community. So it's a really good time, I think, to pull forward those questions you have about what's going on, what's been exacerbated by the pandemic, and the solutions that are underway. Now I'd like to make some announcements about the monthly themes for the month of June. As we know, we're a few days into June, and this is Pride Month. So we're very excited to celebrate Pride and LGBTQ rights, and hopefully you are finding ways to participate and support our LGBTQ colleagues. It is also Men's Health Month. We'll also be celebrating Juneteenth on the 19th of June, which also happens to be Father's Day. It is also Fruit and Veg Month and Headache and Migraine Month, as well as PTSD Month. So just a few of our monthly themes that we can reflect upon as we think about the month of June ahead. Anna, I also wanted to just give a quick note that as many of us may have heard, there has been a pretty significant uptick in the number of daily reported cases for COVID-19. We've been receiving some notifications and updates from the Department of Public Health about this, and we just wanted to make note for everyone on this call that the positivity rate has been steadily increasing over the last few weeks, and also a slight uptick in hospitalizations as well. There has been a new public health order Let's see, public health isolation and quarantine orders for the general public were just updated on June 1st. You can get all of this information on the publichealth.lacounty.gov website. But just making a note that, once again, we're seeing an increase in positivity rates, and we want to ensure that when people are infected with COVID, that they're following the proper isolation and quarantine protocols per our Department of Public Health. That includes that a person infected with COVID-19 must have a negative COVID-19 test collected on or after day 5 to end isolation on day 6 through day 10. If the case does not test or if their test remains positive, they are required to continue to isolate at least through day 10. So asking everyone to please observe that quarantine and isolation order. The other update is that close contacts in the general public do not need to quarantine as long as they remain asymptomatic, get tested between day 3 and day 5, and wear a mask through day 10 of their last exposure. A close contact in the general public is any person who shared the same indoor airspace with someone with COVID-19 for a total of 15 minutes or more over a 24-hour period while the case was infectious. So please take care of yourself, please take care of your loved ones, and if you need support or information about COVID-19 testing and the availability of home test kits, please feel free to reach out to the Wellness Center at 213-784-9191, and one of our care navigators would be happy to help you. With that, those are our announcements for the meeting. Let me take us through our guiding principles, and then we'll pivot to Jorge for updates from the campus. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During our meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. All right. With that, I'd love to invite Jorge Orozco to walk us through LAC USC Medical Center updates. Jorge.
Good morning, everyone. Really is a pleasure to be here and to talk to our community partners whose voice is so important to guide us in what we do at the medical center. We're 2.5 years into COVID, and we all would have hoped that this would have gone away. We are seeing, as Heather showed, a lot of community spread. So a lot of people are testing positive in our community. Although the hospitalizations of COVID positive patients has gone up, we are not seeing patients who are really sick because of COVID. Most of our admissions of patients who are COVID positive are for other reasons other than COVID. They just happen to have a COVID positive test, and we don't know if it's active COVID or they may have had it 2 months ago and they're still testing positive. So, but we're not seeing a lot of symptomatic patients with a high burden of disease. I'm very hopeful that we can get through a summer surge with sort of minimal illness in our community because of the high rates of vaccination. And so thank you everyone who's advocated and pushed for vaccinations and boosters. I think it's making a significant difference. Heather, did we have other? Yeah, there we
sure do.
So June 7th, we're hosting another blood drive. And if you scan the QR code, you can register for an appointment. We would love for you to participate and help spread the word on the blood drive. We experienced several months ago a shortage across Southern California, and it just sort of highlighted how important having blood supply is to our ability to treat our patients. Pride Month this month. So LA Pride Parade is Sunday, June 12th, and LAC USC will have a group there participating. If you are interested to participate, please register. And we will have LAC USC t-shirts. I see there's raffles also involved in those who register. So join us.
Hang on.
As tradition at LAC USC, we have a great celebration for Juneteenth. And this year it will be on Friday, June 17th, 2022. And this is a celebration of the first national holiday. So actually we will have a day off because of Juneteenth. So we're excited about that. And we have food, live entertainment, resources, and just a great time. So you all are invited. It will be in our outdoor space on Friday, June 17th from 11 to 4.
Yes, and I just want to echo, it was a great time last year, so I definitely encourage community members to come out and join us, particularly if it's a beautiful sunny afternoon. Jorge, does that mean that the following Monday, the 20th, would be the day off?
I believe so. I believe so.
Putting you on the spot like that, I'm so sorry.
I haven't looked that far in my calendar, but yeah.
Probably so, because the 19th, I think, is the actual celebratory day of Juneteenth. Right. Okay, very good. Thank you. Oopsie.
And then our initiative on equity, diversity, inclusion, and anti-racism. Department of Health Services has committed at a very high level to engage our employees, engage our patients, engage our community in input in developing a strategic plan for EDIA. And we are excited because there is a draft strategic plan that we are sharing with stakeholders for additional input. And so we have these EDIA listening sessions. I think today, June 3rd, is the last listening session. But we encourage everyone to help and make their voice be heard.
Great, and I know we can't wait to hear back a report of everything that you have heard through this listening session process. So thank you so much, Jorge. And finally, we just have our COVID dashboard, which I think you've already touched upon.
Great.
Great. So I think with that, we'll see if there's any questions for Jorge from the community. Questions, anyone? Well, I have one quick question for you, Jorge. I understand that that there's some surveys about kind of public opinion, community opinion, and patients. Would you like to make a little note about that? And maybe if people want to participate, they could put their name and or their email in the chat.
Sure, absolutely. Just a little context and background. The name of our hospital is interesting in that LAC plus USC Medical Center is not typically what people refer to our hospital as. And there is a lot of confusion in the community in terms of who we are. Are we a USC hospital? Are we a county hospital? Are we Keck Medical Center? And we often get confused with Keck Medical Center, which is right across the street. So we're in a process of rebranding the hospital. And we've engaged a consultant to help us with that effort. And currently, they have surveyed local community members, general LA County community members, and they're in the process of surveying patients and employees. In terms of their perspective on the hospital, their perspective on our name, their perspective on healthcare, and that will help inform us to develop some alternatives that will be shared. And I'm happy to come back when we have those options available for additional input.
Thank you so much, Jorge. I think we have a question from Juana. Juana, would you like to go ahead and ask your question?
No, no es pregunta, nada más quiero decirlo públicamente. Después de este tiempo de pandemia, me dio mucho gusto haber visto ayer al señor Jorge Orozco y estaba muy ocupada yo atendiendo a un paciente y de verdad quiero decirle que gracias por todo el trabajo que hace para el bienestar de los pacientes en el hospital.
Pues es nuestro placer, Juana, y mucho gusto de verte ayer.
Thank you so much, Juana, for your comment. And yes, we really do need to celebrate all the hard workers and the incredible team effort that Jorge's entire organization has brought to helping, maintain community health and wellness and well-being throughout this pandemic. We too hope, Jorge, that the COVID pandemic does not result, or the small surge this summer does not result in increased hospitalizations that bring more people to the hospital for that reason. Well, thank you so much for joining us, Jorge. We have a few comments in the chat where people are very excited about the rebranding opportunity and really think that it would bring some added clarity to the community about the services of the facility. And I know no one will ask me if I work for USC again if the rebranding goes through. People ask me that all the time. So anyway, thank you so much, Jorge. Thank you, community. And we'll go ahead and move on in our presentation. So I'm very delighted. Next up, we've started this series as of last month where we're inviting artists who've contributed beautiful works of art to the public spaces at LAC USC to join us and talk a little bit about their process and their final artwork. So with that, I'd like to invite Iris Rain to kick off this segment and introduce the artist we're featuring this month, Lorenzo Hurtado Segovia. Iris.
Hi, good morning, everybody. It's an absolute pleasure to be here. I feel like this also sort of kicks off our summer. I've been thinking about what to say about Lorenzo's work. With all of our artists, I feel like I have a lot to, of positive things to say. And the thing that I really wanted to share with you about Lorenzo as a person and his work is what a connection he is able to draw between the eye, the hand, and the heart, and how his level of attention to detail and craft is so intimately connected, and how he is able to synthesize everything into sort of this emotive whole. And it isn't a surprise to me that when we had all the artists who are doing this amazing work on the murals, that Lorenzo's mural was chosen to be the sort of welcoming mural in the series, and the mural that sort of introduces all the other murals to both the inner community of the restorative care village and the outer, the community at large. So anyway, I just want you to think about eye, hand, heart when you hear about Lorenzo's work. So thank you, Lorenzo, and thank you everybody who has been making this process just an incredible journey.
Thank you, Iris, for that introduction. And nice to meet you, everybody. It's such a big group. It's exciting. I'm happy to be able to present today. I will share my screen and then go from there. It's like from the start. Are there any gray boxes blocking your view? Cool.
It's fine for me.
So this is It is blocking me. Here it is. So these first few images are images that show like a background of, of artifacts, places, and like matachines, like cultural details that influenced and primed me as a person and as an artist. Um, those first few images that you saw there, we'll get back to them later as part of the proposal and also part of the mural. I am originally from Juarez, and I migrated to LA in 2001, right after the Twin Towers, and so it was a very big shift in my life. My plan was to go back, but I've been here ever since. I love LA, and because I came as an adult and I grew up in the border, um, and like these formative years made me appreciate the diversity, helped me appreciate the diversity in LA, appreciate how cosmopolitan it is. So people bring items and traditions and ways of thinking, making, and being um, from all over the world. Right? So that is, we live in such a great city. Um, it's at the corner also of the like Europe and Latin America. LA, it's it's this conversion place. It's a unique city in the whole country. These are some of my works now. Most of the works that I'm known for are these paper weavings. They're paper weavings. This one, for instance, is up to 17, 18 feet tall, um, and this is one side of one piece, and then this is the other side of the same piece. So they're double-sided. Sometimes they hang like a clothesline, uh, and they're sculptures and paintings, murals. A lot of them inspired from all of these different artifacts and things that I grew up watching people make. I grew up making myself, and um, I make them like this. A lot of people ask, how do you make this? So I don't have a loom. I just start by painting paper on one side. And because it's paper, I can paint it then on the other side in different colors. It's a big advantage or a difference between paper and yarn or strings or most other weaving materials. I cut them by hand and then weave them by hand like this. Yes, it's kind of like a basket weaving. So I start with this little corner, build up to it, turn it into a side, and then go and keep going. I think of it as almost like a typewriter. So I can only see this march of the piece as I work on it. This one turned out to be, I think, 17 feet long, but I could only see this much as what's in the photo. Everything else, and only one side. So I have to keep track of the other side, keep track of what I had done. And when it's done, it goes on that roller, and here it is, the finished piece on one side, and that's the other side. There's some images that I am influenced by, like abstract art, others by traditional art. And then I also make these sculptures, these wooden sculptures. And just a side interesting thing, all of the materials here were sourced from LA. Trees that fell from the city, and then also the tar from the La Brea tar pits, and the sand from the playa, the beach. This is a commission that I did for a school library for children, and they told me the kids live in a concrete jungle and they want to see some of the animals that are local here. So all of the animals in there are local animals that were maybe pushed off. But you can see from one of the windows, you can see the Santa Monica Mountains, and so I drew inspiration from there. The animals are all from that area. And then this is a table, but inspired by a flower that also grows wild there. And that's how it is with the books. The flowers, is 4 petals, and then they nest on top of each other. Right before the pandemic, I made this. It was supposed to be a tree topper for the county tree over the holidays, but it ended up being on the floor for red tape reasons. And ceramics, drawings. I know these images are going fast, but I want to spend most of the time here. Now that you've seen where I've come from, this is the actual mural that was before it went up. It's already up, so you guys can drive by and see it. But here it is. It was all labeled and organized just to see if the quality was ready. And this is my proposal for something that we're thinking of doing. We're planning on having a kit. It includes a postcard of the mural, not a photograph of the mural itself, but the design of it. And then this would be a little magnet. I chose the tree to be the representative because the tree is iconic. One, there's already a tree at the campus. Two, this is a protected species. And three, it symbolizes strength, longevity, resilience, growth. It grows from a tiny little seed. These would be coloring sheets. And this is the design for the seed. So there's an acorn, paletas. Yeah, I'm gonna go back to that one because can I go? Paletas. This one, the colors I need to work on. This is just a sample. I need to make this one a little bit more readable. But this is a corn, right? Elotero, cempasúchil, and then music was one of the imagery from the community feedback that was very representative and important. So I chose to do an accordion. And now you remember from the beginning there was this woven friendship bracelets and pens. I used to make them when I lived in Mexico and sell them. And I'm thinking of including a sample of them, like a little kit, the string, the pen, and then a video instructional on how to make it. This would be a very simplified version of it, something that can be done by a young kid and very simple to do, but still I think the materiality of it and that part. Also, this is a mini version of the sculptures that that I make and that are also part of the design for the mural. I apologize for this rendition. It's very off focus, but I'm rendering it. It's just a box. This is the box container wrapped in the a texture of all of those sculptures. So it would hold all of the items in it, and that's the proposal.
Wonderful.
Thank you.
Thank you so much, Lorenzo, for walking us through your process and the different investments you've made in your art through your career, how you've developed into the incredible artist you are today. Do we have any questions for Lorenzo? I know we have a lot of wonderful comments running through the chat, but do we have any questions? Would anyone like to either make their question or their comment out loud to Lorenzo? Please raise your hand. Miss Juana. Oops. I think we might. Oh, there you are, Juana. Do you want to make a
Wow.
comment?
Ya. Gracias por compartir eso, Lorenzo. Cuando yo paso donde está tu mural, créemelo que me conecto con mi infancia.
Ah,
Y el área de aquí del hospital, donde están los murales, me trae muchas memorias. Y de verdad es un placer para mí haber sido parte de esto y ver ese arte. Ese mural está bellísimo, bellísimo. Y
gracias,
ahorita
Juana.
que pusiste las pulseras con las plumas, no sé, sería posible como que hubiera un taller o algo participativo donde la comunidad hiciera su propia pulsera o su propia pluma en simbolismo y conexión con el artista y el centro y la villa de recuperación.
Gracias por tus comentarios, Juana, y me parece excelente idea eso. Si fuera posible, lo podremos trabajar. Sí se podría hacer. Algo, se podría hacer algo sencillo o también algo más elaborado, depende de las habilidades del público, pero me parece excelente idea. Y gracias, sí te recuerdo desde el principio. De hecho, fue una junta casi cuando empezaba la pandemia, ¿no? No sabíamos ni cómo saludarnos y eso, pero apenas llegamos y pues aquí estamos. Any other questions or comments?
So wonderful. Thank you so much, Juana. Thank you, Lorenzo. Yeah, I just want to read a few of the comments from the chat, just saying that it helps people connect to the local community and to their homes, that it integrates the local culture with the community. And thank you again for sharing not just your art, but your essence. So thank you. We really appreciate it. We love hearing from our local artists, and we're excited about more to come. Iris, I think we'll be having another artist join us in July. Is that correct? Oops, you're muted. There we go.
Oops. This is a series. We're very excited about it. Actually, I'm just in conversation. So this is for the Restorative Care Village artists. I'm also in conversation with the artist who will be installing a mural on the Child Care Center about how he could come and be a part of the series as well. And just to be, in case it wasn't completely understood, I love Juana's comment. We were a little bit concerned about COVID and distancing and all that. So what, and maybe this is something that we can talk about with Rosa and Heather and Jorge. Just to be clear, what Lorenzo was talking about is that we are currently working on an activity kit, which is part of like an extended part of his Restorative Care Village project, which will be for distribution in the community. And that activity kit includes like a little pen making kit and the postcard he showed and the magnet. So we were thinking along the same lines as Juana, but trying to figure out how to do this in sort of the safest way possible. But very happy to entertain also more in-person ways of doing it.
Yes, that's wonderful. I love, we love the opportunity to, help bring the artistic, kind of the artistic, what is it? The artistic flavor to more people so that they can experience and celebrate their own artistic impulses and creative spirit. So what a wonderful gift to give back to the community. And of course, it just beautifies our campus and connects us more deeply to them. So thank you so much, Lorenzo, for joining us today. Thank you, Iris, for helping us arrange this artist civic arts series. With that, we'll return to our presentation. I'm very excited that next up, we're here to talk a little bit more about our restorative care village. So let me dig back in on that. Oops. Okay, bear with me one moment. Sorry, guys. I apparently do not know how to start on the right screen, so we're going to go through everything. Okay. Here we go. So next up, we're going to have a nice update and kind of conversation about the Restorative Care Village. We're joined today by Dr. Brad Spellberg, Dr. Rebecca Trotsky-Sir, and Shalonda Williams of the JWCH Institute. I know Mariela Gorosito from Telecare was hoping to join us. She wasn't feeling great yesterday, so I hope she's with us today, but we'll move forward with our presentation in any case. I just wanted to share before we watch a great video introduction to the Restorative Care Village, a few photographs that were taken just the other week that just show how far we've come, the beautiful new facility that's, that's on Zonal, just at that corner of West Campus. And then here you'll see some of the beautiful artworks that are on display at the Restorative Care Village. So we're super excited about that. I know, I believe Brad is with us. Brad, do you want to make any comments before I kick off the video presentation?
I think you can start the video and then we can make some quick comments and then have a discussion.
Okay, that sounds great. Let's go ahead and start the video.
Hello, I'm Dr. Brad Spellberg. I'm the Chief Medical Officer here at LA County USC Medical Center. Welcome to our brand new Restorative Care Village, the culmination of Supervisor Solis's vision for integrating community health into our medical center facilities, wellness, and healthcare. let's go in and take a tour. Shortly after Supervisor Solis was elected to the 1st District in late 2014, she had her first meeting with us at LACUSC, and in that meeting challenged us to begin to think about how we could provide care not just in the hospital, but to serve the community around our hospital. When our team got together to figure out how we were going to address that challenge, led to the conception of the Restorative Care Village idea. It was then joined by Dr. John Sharon as the Director of Mental Health, and the idea just took form. And here we are, phase 1 is now built, and we almost have occupancy in our recuperative care beds and our residential treatment beds for mental health patients.
All right. Okay. So with that, we'll invite Brad to share and elaborate a little bit on the video we just saw and kind of where we are in the process, our next steps, and what the community can expect.
So as people may recall, boy, we've been talking about this for quite a while now, but it's amazing to see it having become a reality and become a reality with this group's guidance, frankly, fulfilling a vision that this group helped us to set. There are 3 phases planned for the Restorative Village. What is built now is phase 1. Future phases are not yet funded. They remain drawn up in plan form, but we don't yet have funds to build. Phase 1 includes 2 components, 96 beds that we call recuperative care beds and 64 beds that we call residential treatment beds. Recuperative care is a temporary housing with wraparound services for patients who are not sick enough to need to stay in the hospital, but either don't have a home to go to, or they may actually have a place to go, but there's no one there. They would be on their own, or the person who lives with them works all day. And they need a little more assistance than they're not ready to be completely on their own yet. The idea behind Recoup Care is a 6 to 8 week generally stay, so sort of a short to intermediate term stay to get stronger. If you have wounds, to get your wound care so the wounds heal, to get physically stronger so that you can then reintegrate back home, or if you don't have a home, it buys our social workers time to find permanent housing for you. It's a bridge. Now, the reality is we hope to target 6 to 8 weeks. The reality is there's no end date, and people not infrequently will stay for months until they can get to the next step planned out. Residential treatment is conceptually the same thing, but it's for psychiatric patients rather than medical patients. So these are patients with mental illness. They are not acute enough to require hospitalization, but they are not yet ready to live independently, or even ready to be adopted into housing in the community and function largely independently in that housing. We do have access to Recoup beds now, many of which are actually staffed by JWCH, scattered throughout the county. This will be the first time we've ever had Recoup beds on a medical campus, on a DHS medical campus. This is important for a couple of reasons. One, it's 96 more beds, and we don't have enough Recoup beds. People wait a long time to get into recoup because we just don't have enough beds. These 96 beds are going to make a big difference. Two, as we've talked about with JWCH, we'd like this recoup to be a slightly higher level of care than has traditionally been available elsewhere because it's on our campus. Right now, when we send patients to recoup off our campus, it's out of sight, out of mind. They're not ours anymore. That's just a discharge, just like you were discharging them anywhere else. These patients are going to be on our campus, and we want to continue thinking about these patients as if they are ours. We have therefore created an infrastructure, and Dr. Trotsky, who's on the call here, is going to be the physician liaison to the recoup beds, so that if the JWCH staff needs some medical support, instead of just saying, okay, I need to ambulance this patient back to the ER, they will have the ability to call and say, hey, I needed this, or I needed that, or this is happening, what do you think? Which could help us take care of simple things that could prevent the patient from having to come back to the ER. Dr. Trotsky also is a board certified addiction medicine specialist, which will be very helpful for those of our patients who end up in the recoup beds with substance abuse disorder. Substance use disorder. There are wraparound services as part of the JWCH service suite in the building, but having a physician who's really experienced at this is going to, we think, be very helpful to the JWCH staff caring for these patients in the buildings. The two other things I'll say, and then we can ask Rebecca and Josh Banerjee if they have any comments, and then open up to discussion. The first thing I'll say is the mechanism by which we get patients into these beds is through the Department of Health Services Housing for Health organization. So when patients are in our hospital or if they're in our ER, we fill out a Housing for Health application. It goes to the DHS Division of Housing for Health, and then they place those patients in the appropriate setting. We will get preferential access from LAC to these beds because they know they're on our campus, but other hospitals around the county will also be able to access these beds through Housing for Health. And then the second thing I'll say preemptively, because this question comes up a lot, there are no restrictions for use of these beds. Immigration status is irrelevant. Those questions are not asked. Insurance status is irrelevant unless you actually have private insurance, in which case they may not authorize it and they may tell you to go somewhere else. So ironically, this is one of the examples where having no insurance or having Medi-Cal might be easier. Private insurance patients, they may actually require us to go somewhere else and not into these recoup beds. So there's no restrictions to lack of insurance. There's no restrictions regarding immigration status for accessing these beds. And as I've already said, the beds are intended to help us care for patients with substance use disorder and who have both sheltered and unsheltered homelessness issues. With that as a general introduction, Josh and Rebecca, any comments you'd like to make?
Hi, everybody. This is Rebecca. Hopefully my audio and video is working well. I am so thrilled to be here with you guys. All of us physicians and team members at LACUSC are here because of you, the community, engendering support for projects, making it possible for us to do our jobs. And it's always an honor to be able to do exactly what I would do. If you paid me $1 million to do something else, I would not take that job. So it's because of you and all these intersectional, critical, hard and challenging tasks that you all do in nonprofits and as community members that lets a project like this fly. And I'm so excited to see it continue to fly, and we will be checking in with you guys for ideas, for support, for enthusiasm. I know that Ms. Shalonda Williams, who is with our community partner, is also on the call, so she can say hi, but this is one of the amazing community government partnerships that we are working on and get to work on and see thrive in our community. We all live here too. We all know that people experiencing homelessness is one of the biggest care crises in Los Angeles right now, and this is something we can do, and we're so excited we can do it.
Thank you, Rebecca. Josh, do you want to add a comment?
I'll just add, I could not be more energized about this, about the restorative care village coming to fruition. And I just, I'll say this is just, I think I said it in the previous forum, this is a game changer. Dr. Trotsky, sir, is such a special doctor, person, leader. She is exactly the right person to help us bridge this, form this amazing partnership with our partners at JWCH and our community partners. And then the final thing I just want to say is to thank this group and our facility leadership and county leadership for bringing this, making this vision a reality. It is incredibly inspiring and energizing. And as you can just see from the videos and the pictures, it's really, really exciting. So that's all I'll add.
Thank you. Thank you all so much for joining us. Yeah, I think everyone is so thrilled. And to think that it was 18 months between, dirt to buildings, almost on the verge of opening. It's really impressive. And I think of that white paper that was produced a couple years ago with that vision of this healthcare campus with the full continuum of care across this medical center, and how exciting that is for our patients and for the community we serve. We do have a question in the chat from Reverend Ray Fukumoto. And before I read his question, I just want to welcome so much the members of the Japanese American community that have started joining our public conversation, both in this setting at the Health Innovation Community Partnership and also last night at our concluding meeting for the General Hospital and West Campus Feasibility Study. So welcome, Reverend Ray. And his question is, are these facilities bicultural, bilingual for all the diverse communities being served?
So I think we now want LaShonda to weigh in, because remember, the operator of these beds, the operator of the recoup beds, the residential treatment beds have different operators because they're psych specialties. But let's maybe ask LaShonda to describe the programming that's available, and she can talk about the multicultural and multilingual issues.
LaShonda, are you with us? I don't know if I'm not sure that I see her in the queue, unfortunately.
Okay. So it's difficult for me to describe precisely the programming that's in the buildings because I'm not the operator of the buildings. But what I can tell you is that as I mentioned, we send other patients to recoup beds all over the county, some of which are staffed already by JWCH. And our experience is that they have no difficulty with, oh, Shalonda's saying she's here, but we can't hear her.
Oh, no.
Okay.
Okay. Hi, Shalonda. Yeah. Interesting. Shalonda, can you tell us what name you're under? I don't see you in our participant list. Oh, there you are. There you are. Wait.
I'm going to try to merge her audio.
Okay, thank you so much, Sophia. Okay, give us a quick second and we'll fix that that tech glitch so Shalonda can join us. All right. So once again, I think just to reiterate, 5 buildings have gone up. That's 160 beds for short-term support, as Dr. Brad shared with us, really providing that bridge and additional supportive services to people before they're able to either be placed in a housing situation or return to their own home and community, but with the care they need to be able to take care of themselves. Yes.
It's Monica. I just have a quick question. So,
Yes.
will anybody ever be discharged to a shelter? Like, let's say that they've stayed for a period of time, and I don't know. I'm just wondering, as far as like a discharge, if they have no place to go, will they stay there until they have like a permanent place to go, or will they ever be discharged to a shelter, which tends to be an issue? Just asking.
So I see we have Shalonda. I don't know if we can hear you yet. Do you think?
I'm here now. Can you guys
Oh,
hear me?
great. Yes.
Awesome.
Success.
Sorry about that.
Yolanda.
Good morning, everyone. So to answer that first question, we will have multicultural and bilingual staff on duty here. Where's my these tech issues? Sorry about that. Was there another question? I'm sorry.
Yeah, the first question was, from someone from the Japanese American community, kind of a question about that bilingual, bicultural staff. So thank you for, for responding with the inclusivity of the center. And then the next question was from Monica Alcaraz. We understand that people being discharged from the facility, if they don't have a home of their own, that Housing for Health will kick in to help support them in getting a permanent placement or semi-permanent placement. Her question was, will anyone be discharged to a shelter situation from the restorative care village?
If the clients are recouped, they're recovered from their condition that had them here, and they no longer need the recouped bed, they will be stepped down to a lower level of care. That could be a shelter, or it could be shared housing. There's different avenues that will be taken in that event.
Thank you, Shalonda. We have a question from Ari. Ari, would you like to ask your question?
Yes. So something that Dr. Brad said was that 96 beds was going to make a big impact. So what I'm wondering is, what kind of impact does that indicate? Is that less homeless people, less in the streets? Does that mean less more room at the hospital itself? What does that mean to us in what we see as impact to the community?
I think it means exactly everything you just said. The hospitals will be decompressed a little bit more. You'll see less homelessness, and these individuals will be taking care of their health needs and not be on the streets and jamming up the emergency rooms and hospital space.
100% echo what Shalonda just said. One of the challenges as a hospitalist and a care provider in our acute care center is we want to take care of everybody, and our hearts go out to everybody, and we want to ensure people receive the right care at the right place at the right time. And so patients who don't have a place to go can sometimes stay in our hospital for longer than needed while we're finding a good place for them, like a restorative care center. And when we have places like this so close to our campus, we're able to take good care of our patients and keep those beds open for other community members who need care as well. So we're hoping that it increases our ability to see more patients in a timely manner, reduce stays in our ER, and all the things that we've been caring about for so long in our medical center.
Thank you. We have another question from Alonso.
Hi, Heather. Thank you. This question is for Shalonda. Shalonda, from your other recuperative care units, would you be able to ballpark, if you don't have the numbers on the top of your head, how many of the clients that were in your recuperative care units were placed in permanent housing, and how many were placed back in shelters? From the experience that JWCH has with recuperative care. And I have a second question. When a patient is no longer in need of recuperative care, who decides to discharge the client? Is it GWCH staff, or is it a collaborative effort with LAC-USC and other disciplines? Thank you.
Okay, so to the first question, I don't have a number, but the 7 years that I've been with Wesley at the MLK Recoup, I can say that more of our clients have been housed than we have sent to the shelters. And when it comes time to exit, that is a collaborative between the LAC-USC staff, the Housing for Health, interim housing, program manager, and JWCH staff.
Thank you for your question, Alonso. Steve, would you like to ask your question? And welcome, Steve. We're delighted to have you with us today.
Good morning. And actually, it's not a question, but rather a little further clarification on the crisis residential programs. We will be one of the operators in 2 of the buildings. And I just wanted to further comment on the decompression. Part of the beauty of this missing level of care is that you have outpatient treatment and you have acute hospitalization. And there are people that need less than acute hospitalization. For example, we also operate some of the behavioral health urgent care centers in the community. Exodus and us, we both share those programs. And you have people that need a longer length of stay than the 23 hours and 59 minutes that we're allowed per our licensing, but don't necessarily need the acute hospital bed, but need further stabilization, whether it's for adjustment on their psychotropic medication or just a safe milieu where they can continue to work on their behavioral health issues. And so the CRT will be stepping down from acute hospital beds where someone needs further stabilization, from the behavioral health urgent care centers that won't be sending them to the hospitals. So that's going to be part of this whole tapestry of creating the levels of care that are missing currently that will decompress the hospitals and allow for those behavioral health urgent care centers or people that are brought in on 5150s to actually have a bed in a space in an acute care psychiatric facility instead of waiting for hours or days in an emergency room where they're being kept safe, but their treatment is not really being enhanced the way that it could be in a different environment.
Just to amplify that, Steve, it's very nice to meet you. I'd like our team to connect with you offline, so perhaps Heather could connect us by email.
Great.
Less than half of our acutely hospitalized patients who are in our psych hospital at any given time remain requiring that level of care. They just have no place else to go. Less than half need that level of care. And the result of that, as Steve is alluding to, is it backs up into the psych ED. It backs up so that law enforcement has no place to drop patients off. When they pick people up on the street who need help, it greatly exacerbates the situation on the streets themselves. It's like a chain reaction, and this will really help with that.
Thank you so much. We have a couple. Oh, I'm sorry.
I've been looking for the thing so I can raise my hand, but I can't find it. But,
just go ahead, Monica.
So my question is, what's the census? So 97 beds, it could sound like a lot, or it can sound a little like, like we've been part of this and this is something that we want to happen. But I'm wondering about the census. So I think so that people can get a better understanding, like how many people at any given time may you have waiting to get into a psych bed, because we know that you have to transfer them to a different facility on any given time, right? Because you said that they may wait in the ER for a while or whatever.
So at any given time at LACUSC, specifically in our psych hospital, in our inpatient psych hospital, there are probably on the order of 30, somewhere between 25 and 30 patients who were admitted but have gotten better and no longer need hospitalization, but have no place to go. In addition to that, there are usually on the order of 5 to 10 people in the psych ED that would end up going to the psych hospital, but might be able to improve over the period of 48 to 72 hours and end up going to one of these beds instead of going all the way to a full psych hospitalization. So I'm going to ballpark it at around 30, maybe 35 at any given time for the psych beds. For the recoup beds, that number is on any given day probably on the order of 20 or so. And remember, other hospitals will be using these beds as well. But if we put 20 patients in, I guarantee you within the next week, we'll have 20 more. There is a large demand. These 96 and 64 beds are not going to solve the problem. They're going to really help.
Thank you so much for the elaboration on kind of, just how this is going to help support the overall flow, patient flow, and care model at our medical center. We have a couple questions, both from Reverend Ray and from Juana, really speaking about elderly patients in particular. those that might need that extra level of care upon discharge, and kind of if there's any different protocols for people that are, are elderly individuals who might be needing the recuperative care services.
So one of the amazing features of working with JWCH and Wesley is that they have years, if not decades, of experience serving that patient population. And we recognize that the intersections of homelessness are really strong with other factors of social isolation, including being an elder or speaking non-English or having other kind of features that make it hard for people to engage in traditional systems of care, or having it hard for the systems of care to deliver appropriate services to them. So Wesley Clinic has an amazing wealth of experience and multiple strategies of interventions for our elders and for our diverse community. And really, if I can speak to how impressed and amazed I was by their commitment to serving all patients, regardless of any sort of social factor, and just watching them take care of somebody, hold their hand, do whatever is needed to make sure that they both grew in their health abilities and understanding of what's going on with their health conditions and in their social needs. So like, how do I fill out housing forms? How do I get a rental application done? And really working with somebody, no matter where they're at, patiently over and over again for as long as it takes in order to get that need met. And I'm sure Shalonda can speak to patients that she has taken care of personally and seen in her organization as well. But this is such one of the reasons the county chose to partner with Wesley.
And in my experience, sometimes if we can make that connection to like a boarding care or a high level of care, we do hold on to those elderly clients a little bit longer. And like Rebecca said, we do whatever it takes. So we don't just let them loose.
The elderly is one of the more common patient populations that we will refer over to Recoup for the reasons that are being mentioned. So there's tons of experience with this.
Yes.
Wonderful. Wonderful. Yeah, I think we're all excited to see how this really delivers on this incredible set of opportunities and promise. We have a question in the chat. Agnes is asking about the program's activities available to those in the recuperative care and crisis residential care facilities. So what kind of programs and activities will people be able to participate in as residents of those spaces?
The clients here at the Recoup, we will have groups for them, substance abuse, activities of daily living. We'll have some fun things like karaoke, movie nights, arts and crafts. We do haircuts, hairstyling, fingernails, a lot of fun for them.
That sounds exciting. Steve, do you want to add anything?
It would be all of those things, and also just really focusing on when referring to activities of daily living, it's going to be depending upon the population and the experience of the individual coming in. It could be doing things as much as hygiene. It could be learning how to do laundry. It could be meal planning, shopping, cooking, things. It's really going to be skill building for people for independent living. Along with that, there'll be mental health groups, substance abuse groups, and really medication management, and really focusing on the strengths that people bring with them that they may or may not even be aware that they have. It's a very strength-based kind of program, working on the innate skills and abilities that people bring to the table, and really shoring them up, focusing and helping to move people forward with their lives.
Fantastic. Thank you. I think this will be probably our final question. Ari.
Yeah, so thank you so much for the additional information on the activities at the new center. So especially when you said haircuts and things like that, I was wondering if there is an opportunity or a plan to engage some of the area. For example, I know there's a cosmetology school right across, on the other side of Lincoln Park. It would be great to get the students involved. Also, there's other like a makeup, facials and things like that at the occupational center. So I'm just wondering how our community resources could be added to the programming or be part of the programming, maybe even in an internship, student internship opportunities.
I think that would be a great idea. If I can have someone reach out to me to get that started, it would be wonderful. I had no idea there was a cosmetology school so close.
Yep.
There's a lot of incredible resources in the community, and I think this is a table where you can bring requests and ideas forward, and we're delighted to share with you. I think that's one of the things that's really wonderful about this Health Innovation Community Partnership. It draws people from the local communities to really hear and understand what's going on the campus and find ways to intersect and collaborate. So I absolutely will make sure to connect the operators on this call and beyond to you, Ari. So hopefully you can facilitate some dialogue and connection. So thank you so much for that suggestion. And then, okay, so we got one more hand raised. So we're going to go final question to Joanna. Johanna, would you like to ask your question? Oops, Johanna, you're on mute. Sorry.
Yeah. Well, thank
There we
you.
go.
Hi, good morning, everyone. So it wasn't so much of a question, it was a comment. And even working with the homeless population, even for myself, I mean, it's really pivotal that we have wraparound services. And what that looks like is not only, I know that you guys are doing awesome with the hospital and the shelter, but also sometimes family reunification, and if that's possible, if we can actually put that in play, because sometimes our homeless population, they fall off with their family, and if that is possible that their families are then reunited with them, that would be so much help, because then they isolate themselves, he or she isolate themselves. So if that was possible, I would greatly appreciate that if we did implement that in social services.
Thank you for your comment, Johanna. I think I remember that some of the modeling is around, services not just for the patient at the facility, but for the family as well. And I know that there's a lot of, a lot of bridge building, like you say, reunification, destigmatization of issues that can also support. Shalonda or Steve, would you like to comment on that?
Yes, in my experience, I think that is one of the best parts of this job for me, because we have sent clients back to Cuba and Mexico to be with their families. So that is something that we do with JWCH.
And also with involving families as possible is always welcome. And the other comment from Ari, one of our motto for our organization is partnering with people for positive change. And so part of the notion of bringing in other community resources is great. An example of that is just recently in our Behavioral Health Urgent Care Center in Long Beach. We just 2 weeks ago started a partnership with Long Beach State for their nursing program, and we're now on a nursing psych rotation there. There's so few programs that offer that kind of training ground, so we're always looking for opportunities of partnership. So Ari, feel free to get in touch.
Great, thank you so much, Steve. I'm gonna just make an announcement, and then we'll ask Andy to make his comment or question. But as we mentioned at our last meeting in May, there are hiring opportunities coming up. So as we think about building the care team that's going to be working at the Restorative Care Village and making sure that care team is deeply connected to the community, we'd love to support the local and targeted worker hire approach that is championed by our partners at WEDAX. You'll see on the screen here a summary slide I received from Isidro from WEDAX about open positions at the Restorative Care Village. You'll see 3 agencies here that are actively hiring: JWCH, STARS, and Telecare. And then we have some flyers here posting information about how to connect and apply for those positions. So we will make sure that these are shared with people on this call and through the network, and also they'll be posted on the HICPLA.org website. So Andy, would you like to make a comment or question? And welcome, Andy. It's been a while. We're so happy to have you with us. You are muted if you're trying to speak.
Sorry, I wasn't expecting you to ask me any questions here.
Oh, Andy, you had your hand up. I wasn't. You put your hand up, so I was asking if you wanted to say something.
I must have mistakenly done so. I'm just glad to see the project being completed and being successful. And of course, I'm always happy to participate and see things going well over the campus.
Yes, well, we're so happy you're joining us back to for these final announcements. We're, like I say, super excited to talk about the opportunity, the hiring opportunity, the local and targeted hire, and also, of course, we're working our way up to the ribbon cutting for the restorative care village. We do have an announcement that is likely to be in June. A specific date is being selected, so we don't have that information quite yet, but it is coming soon, and we're very, very excited about the prospects for this incredible facility on our campus and opening and coming soon. And we know we'll be hearing more from Shalonda, Steve, and their colleagues. So thank you for joining us today, everyone. Really appreciate it. And I know we'll be seeing more of you in the future. So thanks again. All right, moving on in our presentation. Now is the time we're going to give you a quick update on our General Hospital and West Campus feasibility study. As we know, after 3 years of community engagement and technical analysis, the feasibility study was completed in April and submitted to the Board of Supervisors. The full study is available for download on our project website, hicpla.org, on the General Hospital Feasibility Study tab. We have the English language study and appendices, and we have the Spanish, and now the study has been translated into Spanish, so you can download and view those on our website. We also have a space for you to leave comments and feedback on the study. So please take a moment and submit a comment card with your thoughts about the study. We will collect those and share them out with the team that is taking next steps on this project. I wanted to report back last night was our final community at large meeting for the feasibility study. And that was last night, 5 to 7 p.m., hosted via Zoom. We also were so excited to bring some of our guests to an in-person live stream at the Medical Center campus. In total, we had 131 attendees via Zoom and 10 attendees in person for our live stream. If you were unable to join us yesterday, if you missed part of that meeting, the meeting was recorded, and the materials, including the presentation and the recording, will be posted on the HICPLA.org website in about a week. You'll see here, this is the website screenshot, including the tab General Hospital Feasibility Study. The resource library is where you'll find documents for yesterday's meeting as well as all previous meetings. So if you want more information, this is a great place to log in and get that information and stay connected to the project. I do have a very exciting announcement. I'm going to invite my colleague, Ben Feldman from Supervisor Solis's office. Ben, are you available?
He's joining right now.
Rosa, I think you are also with us. Is that correct?
Can you hear me?
There you are, Ben. Sure can.
Hello. Sorry, I was switching devices, so I'll turn off my own echo. It's a pleasure to meet you all, and thank you so much for putting together this slide. We have some very, very exciting news, which is in the state budget process. For some general background, it's a big negotiation between the governor and the legislature, and we're at the point where the governor announced his budget, and the legislature on, what was it? Last night, the night before, came out with their unified budget between the Assembly and the Senate. And in that unified budget includes $50 million for the General Hospital redevelopment project. So that is huge news. We are deeply grateful to our partners in the Assembly and the Senate. We're holding our fingers tight. We're very helpful. It's not done until, the dollars are in our hands and the governor has signed it, but this is very, very good news for everyone. So good reason to go into the weekend with lots to celebrate. Thank you, Heather. Thank you, Rosa.
Thank you so much, Ben. Yes, that is such exciting news. The Office of Supervisor Salif has been advocating at the state level for funding for the restorative care village, as well as the general hospital reuse. And the good news came through this week that $50 million, as Ben mentioned, is in the budget at this time for the general hospital reuse. So that is really, really exciting. Obviously, we're just thrilled about the next steps and the opportunity and potential of the General Hospital and West Campus project. So thanks for that update, Ben.
Anytime with good news, I will run to you, Heather.
Wonderful. We'll take it all. Good news preferred, though, definitely. Thank you so, so much. All right, next up, we've just got a quick little update. Not really new information, but just an opportunity again to visit some of your questions and share with you some highlights of the next step in the General Hospital and West Campus initiative. And that is going to be provided by Doug Cohen, who is responsible for the RFP process. Doug, want to join us? Oh, and I should update that slide now that you have a new departmental title, and I will make sure we take care of that by next meeting.
Thank you, Heather. And I apologize for the poor connection here. I'm going to have to keep my video off. We had a great meeting last night, and essentially we have initiated our RFP process. And the first phase of the RFP process is actually to engage discussions internally as to what our strategy is for the RFP. But essentially, the RFP, just to back up, is a document that'll detail the project requirements. It builds in all of the expectations from the community, from the county, and the stakeholders involved in this in the development site. I wanted to spend a little bit of time just reinforcing the difference between a requirement and an expectation. A requirement is where we build in the minimums, the minimums in terms of how the proposals from the developers are going to be assessed. They have to have a certain minimum standard to even qualify. And this not only involves the capacity to do the deal, but also to address, again, the minimum requirements for things such as housing and contracting. The expectations is where we start to build a real separation among those proposers. And this is just the idea, is we want to challenge the developer community with how they come about proposing for the entirety of the build out. And so the strategy that I'm talking about is something that internally will take place over the next 6 to 8 weeks. We will then have a break in activity where we step back and engage the developer community. And then we will come back and finalize the draft ahead of the actual posting of the RFP. I'd like to actually advance to the next slide. There's a timeline here that kind of breaks down a lot of the talking points that I'm addressing right now. The RFP release in fall of this year, we're estimating it'll be probably September. So here we are in June, and at this time, what we're engaging in is how are we going to present to the developer community a platform by which they can clearly see what our expectations are. And again, our expectations is that they will sharpen their pencils and they will come in not only with best practices for cost, but also best practices for two other very significant areas: quality, and quality would be, and with respect to, let's say, the affordable housing, what is the mix? How aggressive can that affordable housing be? So quality is a quality of life standard as well as just the quality of build. And then the third very, very important thing is the timeline. We want to make sure that the developers are presented with expectations where they can clearly see they're going to be assessed on how they can deliver this quality in as expedited a delivery period as possible. This all takes time to really put this all together, and we're expecting that we're going to have about a 4-month period to really finalize the draft of the RFP. This blue area, the middle stage, is where the developers now have seen the RFP, and let's say that would be late September, and then during the course of probably another 4 months, They're going to be preparing their proposals for submission. And in that period of time, we'll also have some fine tuning through a Q&As that are available to the developer community. The idea is as we advance through October, November, December, and into January, in late January, which is the winter of 2023 here, that's when we would expect to be having the date where all the submissions are due. The next and final phase of the RFP process would then begin. And that's when we get into the review of the proposals, the selection and non-selection of the proposal teams. And then the most important piece of all of this RFP process is when it culminates in us returning to the board for the authority to, in fact, select the developer and then engage in a series of agreements that would launch the entitlement process that goes forward to the build out of the site. And so we can advance to the next slide, Heather. A key component of all of this is our participation with you here at the HICP. And we stepped into, there's kind of a handoff that's going on between the body of work that's been going on for nearly 3 years now that engages this very thorough community engagement piece. But there's a structure to it. And we've been provided the luxury of stepping into this structure that's been provided not only by the foundation, but also in conjunction with the supervisor's office and the CEO's office. And it's an extraordinary structure. It's a tremendous benefit that we're stepping into. And we want to take advantage of that in a way where we can include the participatory role of the foundation in the drafting of the RFP. And then also a second point of contact where we provide a participatory role in the selection process of the developer. And so we're working right now internally with county council and the guidance that we need to actually formulate that process, because it is in fact an unusual process to bring in community engagement into these two areas of the selection process. And I will be available for any Q&A. Thank you.
Thanks so much, Doug. As always, we greatly appreciate, the time you spend with us and your real intentional commitment to our community inclusion in the process. So we've shared these slides at previous HICP meetings. Obviously, Doug just kind of covered all the material, but just to reiterate, we're in this RFP drafting phase, and then we're moving into an opportunity where HICP, the members can join a subcommittee to have a very specific role in helping review the proposals that will be received around the January timeframe. The nomination process to participate as a member of that subcommittee will be opening this month in June. So stay tuned. I believe we'll be having the application process and form. I hope to get out to everyone next week, and we'll be making an announcement about that again at our July meeting, so that anyone who is interested can self-nominate to participate on the subcommittee. Any questions for Doug at this time? Wow, Doug, I think you've done it. You've come to enough meetings now that all the major questions have been answered. So I think we're doing well here. Any final comments or thoughts from anyone in our any of our participants? Oh, there's Miss Vivian. Hello, Vivian. Please
Hello,
go
good
ahead and
morning,
ask your
everybody.
question.
Yes, I would just like to know, with regards to the HICP subcommittee, how many participants are going to be able to join this committee? And as I know that right now we've got a great new members coming in from our JA community, and of course, we would like to participate as well. So I'm wondering if there's a cutoff to the amount of people that will be able to join this committee.
I'm going to jump in right now, Heather, on that. So
Right.
thank you for the question, Vivian. We don't have a direct answer to your question right now. I mean, just in full candor. What we're doing is we're setting up a process that, quite frankly, we can't point to a template for it. So what we're looking at is how do we create a sub panel that truly will have an effective role in the participation of what is essentially the overall recommendation and selection of developers. What we've come up with internally is what we're referencing as a sub panel. And a sub panel of what? Well, a sub panel of HICP applicants through HICP. So the foundation is providing us the platform, if you will, for this application process. The question you asked was how many, how big? The reason I don't have an answer is because we're leaning toward in discussions that we need to have at least one member of a sub panel per the number of proposal teams, developer proposal teams that we expect. So it's going to be a limited number, but it's also one of the limitations is also the level of commitment that's involved in being a member of the subpanel. Each member of the subpanel is going to have to be able to review every proposal, of the relevant section for community benefits assessment in each of the proposals that's offered by all of the developers that are proposing. So if we were to have 5 or 6 developers, we would have to have at least 6 members of the subpanel plus a few alternates. If we have 8 or 10 proposals, we're still going to need a couple more beyond that for alternates. The idea, though, is I wanted to at least give you kind of an idea of the size of the subpanel. It's not a 50-member subpanel, for instance. It's just not going to be that. We do have to work out and we're involved in working out the details of this. So it's a great question. I want to be able to give you a direct answer as soon as possible on that, because the question you're asking is exactly the questions that we're trying to sort through right now.
Yeah, thank you. Excellent question, Vivian. And I hope that clarified a little bit. The role of the subpanel is like that. This HICP membership is where to come to get your updates and your information and contribute your thoughts and reflections on the process overall. The subpanel role is going to be very specific to reviewing those proposals and providing critique and comment back. So it's going to be a more limited, focused group with a pretty significant set of responsibilities. So we are trying to right size the committee, and as Doug mentioned, the committee members and alternates, so that we have enough people on the committee to really fulfill on the responsibilities, but aren't so overwhelming to ask so much of members of our community in terms of contributing their time. But more to come. We will be, like I say, opening up the application process, taking in the applications from individuals, and then as we start knowing more and receiving the proposals in, then we will be able to confirm participation on that subpanel. We have a question from John. John, please go ahead.
Yeah, so I was actually going to join the subcommittee just to sort of hear out some community voices on behalf of my company, Prime Store. We're going to be submitting an RFP or submitting in for the RFP. So it sounds more like I should not kind of do that. So I just kind of wanted to ask, for aspiring developers, how do we sort of stay plugged into the process from here? Where do I go to, pull documents, ask questions? Is there someone here I should be taking direct contact information from, and where should I go from here?
Well, I'll jump in right now. So first of all, John, Prime Store is a fantastic partner in one of our projects here in the county. It's been a joy to work with them, and we're going to continue working with them through the construction piece on the Vermont Manchester. We certainly don't want you to be part of a subpanel. Okay, then no one else is going to hear me say that. So John, nothing personal. We want you as a proposer, and so I think you understand where we're going there. And just for all joking aside, what John and I are talking about here is one of the very keen areas in this proposal process is we want to bring in community engagement in a way where we don't open up the process to dispute. And so, for instance, John represents a developer who may be interested in proposing to the deal, and we certainly want to have an encouraged platform to encourage the development community to, in fact, bring in their proposals. But we wouldn't want, and I'm getting some feedback here, but the idea here is a developer would not want to be part of the sub panel because then it would constrict the developer from actually proposing. Now, to answer your other part of your question, where are you going to be able to get information moving forward? I think we're going to have, we internally again, and we're just putting this together, John. I think we're putting together a really ambitious schedule for Q&A during and throughout the process, the RFP drafting and posting process for the developer community. I think what we're hoping to do is to put together, quite frankly, a more aggressive outreach and contact component with the developer community throughout this whole process. And that's the idea here. And again, I'm going to talk to beyond the conversation right here with John to the wider audience. What John's question really is going to is the developer, in order for us to encourage the developer community, one of the things is the more certainty we can bring to the developer community during the process, the period in which they're preparing and creating and drafting their proposal, the more certainty we can bring to them during that drafting process, the more the developer community can be motivated to sharpen their pencils, if you will, to bring about more creative solutions. So what we're hoping to do, John, is, and again, it's a little bit unusual, is we're hoping to put together points of contact, Q&As during the finalization of the RFP. That in and of itself is a little bit different than typical. Typically, as you know, you typically would have a Q&A and mandatory walks during the posting period. We're actually going to try to not only have those typical points of contact, but also have an additional one prior to that in the finalization of the draft. And then, of course, we'll have actual Q&A rounds during the actual posting period to help you in fine-tuning the preparation of your proposal.
Thank you so much, Doug. And thank you, John, for joining us. Yeah, we're so excited to have a member of the developer community come and join us at this Health Innovation Community Partnership table. I think you can see from our participation and attendance today, we have a very passionate community that loves their medical center, that loves their neighborhoods, and really wants to make sure that this, all the developments here on campus really reflect the community spirit, the community voice, and integrate nicely with our neighbors. So very excited to have you join us today, and hopefully we'll see more of you in the future. We're going to wrap up with one final question for you, Doug. Reverend Ray asks, what are the qualifications likely to be for someone to serve on the subcommittee? What are the qualifications and or qualities that you would like to see in members of the subcommittee? What should they be prepared to be able to do?
I think that's a great question to ask me because I really don't have an answer here. Okay. And that is so, Reverend Ray, what we are absolutely that this is a front burner element for us. Let me give you a little background. So what we're attempting to do, we want to bring the expertise from the community into a review process of what the developer's proposal, the section of the developer's proposal will be that addresses how they're building out the community needs. So there will be a section of, first of all, the RFP is going to be a very complex proposal process. The proposals from these developers is going to be a significant document in and of itself. It will have sections. In that section and compartmentalization of the proposal, one of those sections will be, and I'm just for sake of making progress in a conversation, give it a label, a community benefits assessment. So that community benefits section will in fact be the section that incorporates all of the needs and expectations beyond the requirements of all this 3 years of community engagement. And we want, quite frankly, experts from the community as to what the community's needs and expectations are in the review of that section. So it's, and I don't want to paint myself in a corner here, but we're not necessarily talking about engineers and architects here, even though in finality, we're talking about a development proposal in entirety. This section is really about the expertise that these panel members would have in recognizing how the developer is addressing the community's expectations. And so I hope that helps a little bit.
Yeah, I think thank you. That's very illustrative, Doug. And as basically you've said, I think there's more to come. This is a really unusual opportunity that doesn't really have a lot of track record. So we're building something to really ensure that those local representatives and champions of the community and the community voice and the community needs have this space to participate in, like I say, and be able to make that commitment of time and effort, because I think it is going to be a pretty significant commitment. So I think those are some of the things we'll be hoping to illustrate through the self-nomination process. But more to come, Reverend Ray, and you will definitely be on our mailing list to receive updates as we have them. All right, with that, I'm going to conclude this portion of our meeting today and move on to the next segment. If you need more information, you're always welcome to reach out to me and also to Doug's colleague, Sophia, to get more information on the RFP process and stay in touch. Once again, always visiting our website, hicpla.org, where information of all types resides about this project and others on the campus. Now I'm really excited. Our last segment for the day is a panel conversation and Q&A. So once again, we look forward to hearing from you. We have 3 experts joining us today to really talk about the experience of people experiencing homelessness in our community, how that might have been exacerbated during the pandemic, and what are the what things are moving forward in being responsive to people experiencing homelessness that gives our panelists hope for the future. So with that, I'm really excited to introduce our 3 panelists. We have Monica Alcaraz from Exodus Recovery, Andrea Marchetti from Jóvenes Inc., and Colleen Murphy from LASA. Let's see, Andrea, are you available? Would you like to kick off
Yes.
with introductions? Thank you.
Yeah, can you hear me? Great.
Yeah.
Good morning, everybody, and thank you for inviting me in today's session. So my name is Andrea Marchetti. I'm the Executive Director at Jóvenes Inc. We are a nonprofit organization based out of Boyle Heights, and we do housing and supportive services for homeless youth aged 18 to 25. The agency was founded in 1989 by Father Richard Estrada, and we are currently the coordinated entry system lead for the youth population, the youth homeless population in Service Planning Area 7. But we also work in Service Planning Area 4. In 2021, we have housed 468 youth across our continuum of care, and 33 of those were system-involved youth. We have a pretty even split between males and female, with 51% male and 46% female and 3% gender non-conforming. And 48% of the clients that we serve were Latino, while 33% were African Americans. And so this is just a brief introduction about Jóvenes, and we can talk later about some other issues related to youth homelessness.
Thank you, Andrea. Monica, would you like to introduce yourself and your organization?
So my name is Monica Alcaraz. I actually started working in homelessness, or actually volunteering, in 2012 in my community, because I saw that I didn't see a lot of services, or actually any services in my community. And then through that, they started the coordinated entry system, and I became the NELA Hub coordinator. I'm not in that role now, but again, I still continue to advocate for my community, and I am with Exodus. Exodus has grown so much. The main focus of Exodus has always been mental health and supporting people with that. But because of we see the need of people experiencing homelessness, it's like a holistic approach. So there's outreach teams, there's crisis houses, there's just so much that Exodus has grown in the community. They're just not in, we have an office across the street, an urgent care where people can get services, but we're all over LA and in actually Northern California and San Diego. So the company has grown so much, and we have just a lot because there's such a big need. But we mainly work with, as far as the homeless part, with single adults, in the single adult system.
Thank you, Monica. Colleen, would you like to introduce yourself and your organization?
Hi, good morning. Thank you for having me. It's great to be with an amazing panelist. You chose two really great partners, so it's great to share this space. My name is Colleen Murphy. I am the Associate Director of Unsheltered Strategies at the LA Homeless Services Authority, or LAHSA. We were founded in late 1993, and we are a joint powers authority between the city and county of Los Angeles. We do a few things. We are the lead agency of the Los Angeles Continuum of Care, which is basically the regional planning body that helps to coordinate services and referrals for families and individuals in LA County. We coordinate and manage over $800 million annually, which includes federal, state, county, and city funds for programs that range everything from street services to shelter to permanent housing. And we work with really great agencies like Exodus and Hoviness and over 100 others to really help the entire continuum work. And that includes, like I said, access centers, prevention, youth services, shelters, and permanent housing. And really look to our partner agencies to create and implement best practices.
Great. Thank you so much for the introductions. So we are opening up the floor to questions from the community, but as we wait for those questions to come in, I thought I'd kick it off with just a question about what have you seen, what exchanges have you seen with regard to people experiencing homelessness due to the COVID pandemic? I certainly think from an outsider's perspective, it seems like things have really exacerbated and changed, but for the different populations you serve and neighborhoods you serve, I wonder what your experience is like.
Yeah, I can start. I mean, our experience as emergency service providers, our program will remain open as all of the one related to homelessness. And so we've been trying to, as much as we could to, maintain a certain level of safety in our facility that led to longer period of time for our client to be allowed to stay in our programs. We have worked with the Department of Health Services to evaluate safety standards as far as safe distancing and number of clients that we were allowed to have in our facilities. And we have implemented a strategy of model support thanks to some of the funding that was developed really specific to the COVID pandemic to be able to allow support in as motel assistance for those individuals that were pending enrollment into programs. So that has been our experience in dealing with the pandemic.
Thank you, Andrea.
For me, I think that and I've shared this with Heather before, but I think that the pandemic was, a bad thing, obviously, for everything that's happened to people, but it's also been a great opportunity and it's helped people think outside the box, right? So we've had a lot of programs. We never stopped working. We were out in the field, trying to figure out how we're going to feed people, how we're going to still support them, since a lot of government agencies were closed, right? You couldn't go get your IDs, you couldn't go get your Social Security, or it was harder. But we figured it out as how to do that. But again, I think that it's opened since that happened. There's bridge housing that were opened in the area that I serve that I had never seen before. Like there was just hotels. Like if you live in El Sereno, you saw that, and you would drive by Huntington Park, Huntington, you would see that there was an island of people, right? We would, an island of people living on the street. But because of Project Room Key and Project Home Key, we saw that a hotel was converted into housing. And most of the people that were living on this island that were from the community went into that housing. Not everybody, but most of the people. So that's a blessing, right? Because we see in the area that we serve, we're starting to see more things that can help people. We have the tiny homes that that opened in Highland Park and recently in Eagle Rock. So we have people that are going in there, right? So it helped people to see the urgency and then just open up what we can and cannot do, because part of the issue is that there's no silver bullet to, solving homelessness. There's no one way to solve it. There has to be a lot of different things. And I think that for me, the blessing of of COVID was that it opened more opportunity. It's still not enough, but I think that we know that there's things that we can't do that before it was a lot of talking. We talk about, Supervisor Shalise, and we talk about General Hospital. One of the first things that I remember being in the meeting was, asking her, and had conversations before with her, is like, why can't the hospital be used for housing? And that's one of the things that the community needed, right? And had asked for. So I think that's part of it, right? I mean, of course, that was before the pandemic, but, having those leaders that can think that way and outside the box has been a good thing.
Thank you, Monica. Colleen, what have you seen change as a result of the pandemic?
Yeah, I think the work that the homeless system, as well as our partners with the Department of Public Health, are really unsung heroes. When everyone was going inside to be safe and locking down and businesses were closing, the homeless sector not only kept open, but we revved up and tried to figure out how to do this work safely and to shift gears also, because we saw a crisis of people not being able to get food, of hygiene. We had to get PPE out there when there was no PPE. And to also track people who are symptomatic and experiencing unsheltered homelessness, as well as within our shelters, and how to create protocols with a huge geography, because LA County is the size of some states. And so how do you keep such a large amount of people safe, as well as our workforce? And so we instituted probably one of the largest street-based COVID infrastructures to make sure people that we could get testing out there. And then when vaccines rolled out, to make sure people were getting vaccinated, and then do all the survival work. And also, as Monica said, an unprecedented amount of interim housing came online. Some of it was already planned, but some of it through FEMA and other COVID funding, we were able to put up very quickly, which was taking hotels and turning them into interim housing. So, a lot of this was happening behind the scenes, but I think it's why we didn't see the huge amount of mortality in those that we serve, was because of thousands of people mobilizing to do this really important work. The first time we had to rethink our COVID protocols of how we did this work. And the first encampment I went to was actually the encampment Monica talked about. And soon after that, we were able to open up 2 project room keys and get, like she said, pretty much everyone in. But early on, when I went to that encampment, I had no place for those folks to go. And that is a hard thing to sleep at night, knowing that folks are entering a pandemic, and where are they going to go? And now that we know they do have beds. But I think the other piece is, as we move hard to get people indoors, is permanent housing, because homes and homelessness. So as the threat of eviction moratoriums, things like that, because the eviction moratoriums help to keep people in homes. And that's what we have to talk about too, is how do we keep people in homes so we don't continue the inflow of people going from house to homelessness. And so very important that we keep protections in place to keep people in their homes, and that we also can identify more affordable housing, so those that we did get into interim housing can move into their permanent housing. And that is a huge key. We will be releasing the homeless count data later this year. We are seeing what our neighbors have experienced. I would say anecdotally, what we've seen on the streets in terms of, has COVID exacerbated the unsheltered homelessness. I think it's hard to say. I think also we saw people moving in a disparate place and moving to safe havens. And so it might have appeared to have been exacerbated, but it might have been just people moving to a safe space to get services and to create community. So we'll have to wait and see what our data looks like when that is released, to see what COVID did, both positive to get people indoors, and also their inflow, it created more people on the streets.
And I think, Colleen, I know we don't have the 2022 data yet for the homeless count, but looking at the 2020, we had that 227 individuals on a daily basis become homeless, while 207 exit the homelessness system. So it's such a complex situation where there's such a high number of individuals that become newly homeless on an annual basis that just the resources are just limited to be able to tackle every new individual that is homeless. And this goes back, as you were mentioning, to the affordability of housing, the lack of wage adjustment based on to the cost of living. And I believe that there is a shortage of about 500,000 affordable housing units just in the Los Angeles metropolitan area. That makes any type of effort, right, in solving the problem of homelessness very challenging. And that's unfortunately the reality of our continuum.
Yes, thank you. We have a question in the chat from Reverend Ray. He mentions being a veteran of the Vietnam War and concern for special programs and outreach to veterans and coordination with the VA.
Great question. So the entities that are on today are but one of those hundreds of agencies we work with. So anytime we find a veteran, we will connect them to VA resources. There's a few ways we can do that, and you can do that. The VA campus itself has what's called a welcome center, and so people can be plugged in there. There's also what are called SSVF providers, and most of our agencies know who those people are for their region and can connect to those resources also. And there's an entire infrastructure of veteran agencies that work to also get the most vulnerable indoors. Also, the Project Room Key program that we talked about, the veteran side had something very similar, called something different, but the same idea of getting veterans indoors. There's a lot of work around the VA campus. You may remember there was a large encampment around the VA campus. And so there was a lot of work happening with VA providers, as well as my agency and other agencies, to get all those folks indoors also, and then a continuation of that work. But very important. And, as whether we find a youth, somebody who's younger, and get them connected to providers like Hovinus, people with mental health needs, and connecting them to the various mental health service providers, or the million other needs that people have. Great question.
Yes, thank you. Kind of a follow-on question, and I don't know if anyone else wants to comment on the specifically outreach to veterans, but there was a follow-on question kind of about that mental health, the mental health services, mental health evaluation that may happen in the field. How is that handled? Because one of our participants mentions being out with a meal food program and seeing the mental distress that a lot of unhoused people are experiencing, and just wondering, how does that assessment take place to identify and support people with suffering from mental illness?
Yeah, I can answer
Monica?
that. So,
Andrea, then Monica.
yeah. So the homeless infrastructure is divided into the three systems of youth, families, and adults, and each system has a standardized assessment where also the mental health needs are evaluated, and that generates a score that is going to be used to develop a housing plan for that particular individual. For us, working in the TAY system, we actually have a program that is based out of the Wellness Center at the LSE USC Medical Campus that really has been very important for us to be able to address some of those needs related to basic needs for those youth that are actually still in the street and waiting to be housed and waiting to be assessed. And so I think the important, and that program is called Innovation 20, it's funded by Department of Mental Health. And I think being able to leverage resources from different funders can really help us mitigate some of the gaps that we have just across the continuum. And so once we identify youth that is in need of services, we'll conduct the assessment, and that those youth are become part of the master list in the coordinated entry system. And then we'll try to identify the right housing option for them.
Thank you. Bonica?
Yeah, so I did street outreach, and for some people you can see it right away, for some people you can't. But one of the things that we do an assessment. We do ask if they've had treatment before, if they like treatment. One of the things that I would always tell people is that, it's hard being on the street, and getting services, mental health services, would be important, because a lot of people may not go into homelessness having an issue with mental health, but that develops. There's a lot of trauma. There's trauma in getting housed. And people don't understand that. A lot of people say, oh, I just need my housing. I need my housing. Reality is that I've seen clients that were housed that wouldn't want to sleep on the bed, that would have a tent in their unit because they didn't want to get comfortable, because they were scared that they were going to lose that housing. So being homeless is very traumatic. Being on the street. So I would always encourage them. And again, it doesn't mean that because there is stigma, regardless, people don't want to be labeled, as having an illness. Although that has changed somewhat, but it's still there, where there's shame in being homeless, there's shame in being, having a mental illness, there's shame in a lot of things. But I personally think that if you're in that situation, it's important for you to get services with mental health. Again, the levels range, and again, you could see it right away in some people. I'm not a mental health, even though I work for Exodus, I'm not a therapist or anything like that. But working in this field, you learn a lot. But again, one thing I would always encourage that, and especially after they get their housing, because people will, again, don't feel worthy sometimes, or feel a certain way. And unless you've lived that, you don't understand it, right? But again, we talk to them. We always encourage linkages to whether it's doctors, going to see if they haven't gone to get a physical or anything like that, mental health, things like that. So for me, it's not like, we do the assessment and ask those questions and that helps. But again, it's always encouraged, I think.
Mm-hmm. And if I can add as well, that's one of the challenges that we also face even in our permanent supportive housing unit, where for a younger population, even if there's a diagnosed mental disability, they just know the relationship with the provider and with medication management. And if we're able to really support the youth in creating those linkages, we see how their quality of life just changes day and night. We've been able to stabilize, and especially in the permanent supportive housing unit, when an individual is being on the street, really going to a doctor or a mental health professional and keeping up with medication, it's just not really the first priority. And so the stabilization process, a lot of time it really goes through the mental health stabilization process. Otherwise, it's really difficult to achieve any other positive outcome that increases the quality of life of a client.
Thank you.
Yeah,
Andrea.
And this is such an important question. So I just wanted to add a couple things, and I'll put a link in a second from just some research that just came out about a week ago, where the California Policy Lab looked at all of our outreach data and then looked at DMH data, Department of Mental Health data, and looking at people with serious mental health needs that were diagnosed. And the intersection of outreach and then what happened with those. And actually they found a really good success rate of people with those high needs being served by all outreach teams, whether they have the mental health component or not. Some of our teams do have mental health clinicians on them. There's also a subset of outreach that DMH does for those that are deemed gravely disabled or gravely disabled adjacent. But what we're finding is across the board that I believe, let me pull up the exact number, 40% of participants that were found to have that higher level of mental health need were enrolled in interim or permanent housing within a year. So it really is speaking to the need for housing first, that while we need everything and we especially need more mental health services, but we really need housing, and that we can get people indoors, and it's a lot easier to heal and to get the treatment you need once you're indoors, especially, you know, and if it's higher level is, you know, permanent supportive housing where services are on site. But, you know, many people with stability can access the resources they need to stabilize even in what we call a scattered site unit. So I think the need looks great, but also I've seen what the average homeless service provider can do with folks when they have the resources in their toolkit.
Thank you. So we are just at time, but we do have maybe a couple more questions if you can stay with us a few minutes longer. If each of you wants to share one out-of-the-box idea that you think would be helpful in addressing homelessness, another question from one of our participants.
Yeah, I can go first. So we have a program that is called Host Homes, where we're trying to identify, and this is just a share, you know, program with the other state provider across the county. But the idea here is to identify individuals in the community that might have a spare room that are not using, and being able to be part of the solution and house, in our case, a homeless youth, so that you know, we're trying to expand the opportunities for housing compared to just sending people to shelters. Heather, if you would like to share my contact information in the comments, you know, we're actively looking for individual. We have a case manager that work with the youth just to make sure that they develop a plan. And we also have a host coordinator that really works more with the you know, with the landlord or with the owner of the property, just to make sure that in case there's any particular challenge, you know, we're able to address that with the youth and with the, you know, individual that it's housing the youth. There's an incentive to be able to open up your home, or if you know anybody, it's about $500 a month to support in you know, additional costs related to utilities and all that. So the program is called Host Homes, and feel free to email me if you are interested, or if you know somebody that might be interested in taking in for a period of 3 to 6 months, youth age 18 to 24 that is really trying to move out of homelessness for good.
Thank you, Andrea. Monica.
For me, it's not necessarily, I mean, I really love the idea and what they're doing at Homeless with that host home. But I think for me, the reason why we continue to get deeper and deeper in this is that, you know, people say we have a housing crisis. We don't have a housing crisis. We have an affordable housing crisis. There's a lot of units that are empty, but because these real estate people can afford to keep them empty, that's why we have this issue. So if there was a way to force, not, well, I guess it's, you know, it is like a commercial thing, but there should be a way where units should not be empty and they should be affordable to people. And there's some way that we could use them. I think it's like, I think I read somewhere that it was like 8%. If they would just loosen up that 8% of what's empty right now, and there's like, they keep track of that somehow, that would really help with this crisis, right? There has to be a way where people can't raise rents 100%, because I've seen that in my community, gentrification, and especially, that's why you see a lot more elderly people that are experiencing homelessness, because they live on a fixed income. Now they can't afford it because the rent is raised. Obviously we do have those units that are not that under that ALIS Act, but if there's some way that we can go back, and again, it's about advocating with those that are representatives, those that are in position of power, like supervisors, council members, senators, everybody, if they really would go back to where rents could not be increased at these crazy amounts, I think that we would be in a lot better place. And then really regulate what a unit could be, because where I live, there was units that were 1,100 for 2 bedrooms. Now they're $3,000. So how can that be possible? So I think that there has to be a way to return that, to not make that be allowed.
Colleen.
Oh, such an important question. I would say doing exactly this, having these conversations. I think the average Angelino looks at homelessness as being driven by someone's personal failures and not the failures of our structures. And if we're going to really fix this, it's about addressing structural racism. It's about addressing the affordable housing crisis. It's about the living wages. It's about looking at feeders and why certain groups move into homelessness and their vulnerabilities, and address those vulnerabilities. Until we do that, we're going to keep having these conversations until we fix those. People struggle because the systems aren't in place to support them in these very vulnerable times. And certain communities, when they do run into problems, have more safety nets to help them. And so we have to make safety net equity also more equitable. And so let's talk about it. Let's talk about what is causing it. And as my co-panelists said, what are the solutions? It's very clear what the solutions are, but it's really about investing in them and prioritizing them. And so we know homes and homelessness, we know that we can get people in permanent housing, and that retention is actually very good. We also need to incentivize people entering homeless services. It's a grueling job. Folks are not paid what they're worth. And also, as the services grow, we need more. So we also need to look at how we can really attract our best and brightest and retain our staff too.
Thank you. We have a question about the opportunities for providing work opportunities for the homeless, giving people experiencing homelessness job training and opportunities for employment to have that experience of kind of dignity and purpose in life. Are there any programs that you guys want to reflect on there? I know, Andrea, your organization really does wrap around for your youth to set them on the right path. Maybe we can start with you.
Yeah, that is a challenge, honestly, because I feel that a lot of time homeless providers are asked to achieve all type of outcome, including employment, which by itself, it's a very big component that, that needs dedicated resources that don't come honestly with our contracts. So, it's part of our case manager to be able to support youth and our client in developing job readiness skills. But I feel that the issue of development, skill development, certificate programs, post-secondary education is really a problem that goes beyond just the homeless continuum of care. And if we look at the cost of living of LA County, really the problem of homelessness, it's also a problem of income, and other systems should be more involved, because it's really challenging for us to deal with the housing, the mental health, and then on top of that also take care of the skills development that can let individual achieve living wages and other type of employment opportunities. One of the things that we've been doing in these last 3 years is to really have a close relationship with colleges, community colleges and university. And so we have advocated at the state level to be able to get dedicated funding to have housing opportunities for homeless students. And that's one way that we're trying to bridge that gap, where we're working now with 10 different campuses in LA County to develop housing strategies for homeless students, so that hopefully by investing in higher education, this individual can achieve, better wages and have more skills, and therefore, leave homelessness behind. But it is a bigger problem than just the homeless continuum of care. And I think that additional systems really need to work with us more intensively with dedicated resources, so that we can leverage their expertise and experience and bring them to our programs, and not try to create with very limited funding, something that it's a pretty big goal to achieve for the homeless population.
Thank you, Andrea. Monica, Colleen, do you want to reflect on workforce development?
Well, I think that's important. Everything Andrea said, right? It's how you're going to get a better job, working at McDonald's or working at, no disrespect to that, but, how can you really live, right? We have students. I mean, I've had students that, left the community to come back, and they're like, I can't afford to live where I grew up, unless I'm living with 6 people, right? But how do you help them? And I think what they're doing with the community colleges is really important, allowing them and finding housing for them on campus, or letting them stay in their cars without any kind of penalty or anything like that. I think we just need to do more. But I think I'm gonna go back to, we need to figure out how not to allow certain things that affect all our community. Like those people that have fixed income, like how many more people that are elderly, that are on SSI, that are on retirement, that they can't, there's no way that they're going to make more money, is to protect them, right? So I think we have to voice that. But again, we have like WEDAX, they have a program where they help people that are experiencing homelessness, but they want people that are in somewhere stable, right? Not necessarily on the street, because it's harder to take a shower, use the restroom, get clean. But providing those services, like Chrysalis, if you've never worked, that's a great program that they have. I just think that education is important, but then you have people that are older that may not be able to take advantage of the education at this time, or maybe they have so much going on. Like, people think homeless people don't do anything all day, and that's not true. I know people that they spend the whole day recycling for nothing. Like maybe they're lucky if they get maybe $10, $20, whatever. They're lucky if it's trash day, because then that's when they may be able to do more. But being homeless is expensive for the people that are homeless. I don't know how would you help them get into jobs, but I think be more lenient, right? For people coming into a job and finding a job that they can do. That's all.
Yeah, I definitely am excited about, growth in this area. There's groups like Chrysalis who do amazing work. I know a lot of agencies, I know our own, hire a lot of people with lived expertise. But again, it's a big piece is not only the job, but the wage. And so we just really need to look across the board in LA about wages. And, you know, the last statistics I saw, LA is one of the largest gaps between wage and cost of living. And so really that structural piece around having that living wage for folks so they don't fall into homelessness and can get out, because I've seen a lot of people working and working hard, but still living in their cars or in a tent because they literally can't afford housing. And, you know, LA at least used to have pockets of affordability, but now there's no affordability. So it all interacts, and it's hard to keep a job if you can't have stable housing. So it's all a reinforcing circle.
Yeah.
If I can add, Heather, with the population that we serve, what we're seeing that even when you know, our clients are able to get a job, the retention is very short because there's lack of that experience on the workplace, on traditional employment opportunities, and we go back a little bit to the mental health. And just the life skills that the youth that we serve have. And so we're trying to develop a different path that is not necessarily going right away for the 40 hours a week that is maybe very demanding for a lot, but experiences where individual can really get a feel of the workplace with more limited hours, a little bit of more flexible schedule to really experience different field of work, to gain more of that confidence, right? Self-confidence and motivation to be able to get and hold a job. And so I feel that retention for our sector, it's even a bigger problem than just being able to get a job to start with.
Yes. Thank you all so much for your time today. Thank you to our participants. Thank you to our panelists. We have definitely gone past time, and I know it's 11. We're at the 11th hour. We got to pivot and let people go on to other meetings and the rest of their day. But I just want to appreciate the work that Colleen, Andrea, and Monica, that you all do in the community, your compassion for people that are really struggling and suffering, and helping them with that hand up to help stabilize their situations and hopefully, you know, reintegrate really positively into society. I think everything you've explored is that set of interconnecting challenges and problems. No one agency, no one department can be the full solution. It needs to be an integrated approach. And I just want to comment one thing out, Andrea, that I really love about Jovenes is that notion that it's not just a set of services, but it's creating community and family for young people. And I think that's the other piece of the puzzle. You can't really have stabilization and support for workforce development, for housing. You know, if you feel destabilized, like Monica was sharing in your housing situation, then maybe you'll never really relax and be able to, you know, commit to this new type of lifestyle. And if you don't have the support to, you know, motivate you to get up and go to work every day and just have that cheerleading and support, you may not get through to that. So there's so many challenges with this particular population and helping people really work through it. So thank you again for your support and work in this area. With that, we will wrap our event up. Happy 4th of July. I know it seems a little premature considering we're only at June 3rd, but I'm making this announcement because next month, unusually, we will not be meeting on the first Friday. We will be meeting on the second Friday, and that is because of the July 4th holiday. So not July 1st. We will meet instead on July 8th. We look forward to seeing you all there. Thank you so much for joining us today.